And welcome back. According to the Washington Post, the Centers for Disease Control and Prevention plans to drop the 5-day COVID isolation guidelines.
Now, according to the report, multiple sources say the CDC will recommend those who test positive for the coronavirus may be able to return to their routines if they've been fever-free for at least 24 hours without medication. This same standard applies to flu and RSV. Joining us now is Dr. Benjamin Neuman, a virologist with Texas A&M University. Thank you so much for joining us, Doctor.
Happy to help.
So what, if anything, has changed with the actual science that might lead to this shortened isolation period?
Yeah, nothing has changed with the science whatsoever. And if you think about it, remember back to the last time someone in your household was infected. They were infected by someone out in the public who thought that they weren't sick enough to need to isolate. I think as humans, we are not very good at making this call, and I don't think there's any good reason from a scientific point of view for this change, if it should go ahead in the future.
Okay, and the World Health Organization, Dr. Neuman, says the Jn1 variant is spreading pretty rapidly. What are you seeing? Is the disease severe? We know that infections are on the rise.
Yeah, the disease is about the same as any of the other variants. Whenever a SARS coronavirus gets through your immune system, generally the disease is going to be a grab bag of those symptoms, which can be quite severe and still hospitalizing a lot of people. The thing about Jn1 is that this is a vaccine breaker. So this evades even the newest, most updated version of the vaccine and makes it definitely time for the FDA panel to look at updating that vaccine, since this is nearly 100% of the cases we're seeing in America right now.
So when we talk about making this change, possibly the CDC recommending this change for less isolation, there's no science behind it, you say. So what is it? I read an interesting quote about, I think it was in the Washington Post articles, that you can have all the science you want and it could be as ironclad as it is, but if people don't follow any of it, it's useless. So do you prescribe to that, so to speak, that if you do, that if you lower these, then maybe people will at least follow them a little bit rather than none at all?
I think, yeah, by dropping enforcement, essentially, by dropping this, you are discouraging the few people that are still trying to follow the rules and doing their part to keep everybody safe. I think you get a world that seems more compliant, but I think you get more spread of the virus. And as a virologist, I take a very narrow view that I would like to see less SARS coronavirus and COVID in the world.
And Dr. Neuman, lastly, what do you recommend that people do if they have COVID? We see the policies are changing. It seems like they're always evolving. So what do you recommend people do? And should they still be masking? Is that effective as well?
Stay away from everybody, yeah. Condoms prevent babies, masks prevent infectious disease. People complain about both, but it doesn't mean they don't work. Yeah, absolutely. Do your part, and the less coronavirus in the world, the better everybody is.
Dr. Neuman, thank you so much for your time this morning. Have a great day.
Happy to help.